Hello, everyone. Thank you for joining our Wellness Talk at Home today. This week, we will be discussing birth control and contraceptives.
We would like to read the Statement of Acknowledgement of Traditional Land just before we begin, and we wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit River. Today, this meeting place is still home to many Indigenous peoples from across Turtle Island, and we are grateful to have the opportunity to work on this land. We hope you have a chance to reflect and to learn about the native land you are currently on and the story of how you came to be on that land.
So for today's agenda, we will be going through a few questions which Mandy will be presenting. Why use contraceptives? Contraceptives before, during, and after a sexual encounter. How we can protect against STIs, consent, as well as provide you with some additional resources.
So for our first reflection question, I would just like you to remember that you can pause your video and think of the answers and then come back to the video when you're ready to see the responses from other students. So our first question is, what types of birth control are you aware of? And here are some possible answers. Our second question is, do birth control pills protect against STIs? And here's our answer. Our third question is, when can I use contraceptives? Here's the answer. For our next question, what counts as consent? And here are our answers, along with several incorrect answers. So our last question asks you to ponder some of the services that the Health and Wellness Center offers. And here are some of the services.
Why use contraceptives? It can prevent pregnancy from occurring. Some can be used to protect against bacterial infections. For example, condoms can be used to prevent bacterial vaginosis from occurring. Some methods are effective at protecting against STIs, as well as some provide health benefits to the body, which may vary person to person and how the contraception is used. A few examples include lessening acne, preventing bone thinning, cysts in your breast and ovaries, preventing ectopic pregnancies, endometrial and ovarian cancers, as well as preventing serious infections in your ovaries, fallopian tubes, and uterus, preventing iron deficiency, lessening PMS, which is premenstrual syndrome, and it can be used to alleviate period cramps and lessen periods as well.
So, for me, I will be discussing contraceptives that we can use before a sexual encounter. I want to preface that all these birth control methods I'm mentioning are all hormonal, meaning that they contain hormones in them. Non-hormonal methods will be mentioned later, and they also all don't protect against STIs. So we'll be discussing the birth control pill, the patch, the ring, the hormonal IUD, and the Depo-Provera shot. So first we'll discuss the birth control pill, which is 92 to 97% effective. This means that 92% is the average effectiveness rate, meaning that if you're not perfect at taking the pill, if you make a mistake, you miss it by a day, you have to take two, whatever the case is, it will be ranging at 92%. Obviously, the effectiveness will go down. But if one is perfect at taking the birth control pill, then it can range up to being 97% effective. So, how does it work? So, it's a pill that contains hormones which prevent pregnancy from occurring. So basically, the hormones are progestin and estrogen, and they are released into the bloodstream when the pill is ingested, and it prevents the egg from releasing once a month by thinning the lining of the uterus and thickening the cervical mucus. It also must be taken every day at the same time. The advantages is that it can lessen periods and cramps, it can reduce acne, and it doesn't cause infertility, which means that if you were to want to get pregnant, you could easily stop taking the pill and you should be able to start trying. The disadvantages is that it must be taken every day and it can cause possible side effects, which include nausea, breast tenderness, moodiness, spotting between periods, and it can also increase your risk of a blood clot, heart attack, or stroke. And if you do smoke, that can increase this risk. And who would this work for? So, a person who likes having a routine and can remember to take it every day. So, next we'll be discussing the patch. Just like the pill, it's 92 to 97% effective, meaning that once again, if you're not perfect at taking it, it will become less effective over time. So, how does it work? So, as you can see in the picture, it's a thin plastic patch that contains hormones in order to prevent pregnancy. So, when you place the patch onto your body, it will release the hormones into your bloodstream, which once again will thin the lining of the uterus, thicken the cervical mucus, and stop an egg from releasing from the ovaries. The patch can be placed on your arm, your back, your stomach, and your buttocks. And how it works is you must change it once a week on a particular patch change day. So if you were to start using the patch on a Wednesday, this would be known as your patch change day, for example. So the advantages is that it only has to be changed once a week, unlike a pill where you would have to take that every day. It lessens your periods and cramps, and it doesn't cause infertility once again. The disadvantages is that's visible. So, for example, if you were to put it on your arm, someone would be able to see it. It can also cause side effects. So, much like the pill, it does cause the nausea, the breast tenderness, the moodiness, spottiness between periods, but it can also cause skin irritation depending where you put the patch. So, who would this work for? It would work for a person who has trouble remembering and still likes a routine. So next we'll be discussing the ring, which once again, just like the pill and the patch, it's 92 to 97% effective. If once again, if you are not perfect at taking it, the effectiveness rate will go down. So how does it work? So it is a small circular silicone ring that you insert into your vagina every 3 weeks. It can be taken out during intercourse. And once it is in your side of your vagina, it releases the hormones into the body, which then thicken the cervical mucus and thin the lining of the uterus and also prevent the egg from releasing from the ovaries. So the advantages is that it is discreet because you can put it in your vagina on your own time and in your own space, and much less than the pill where you have to take it every day at the same time, so you never know what you might be doing every single day. It also only has to be changed once a month, unlike the pill where you take that every day. Lessens periods and cramps, and it reduces acne. The side effects are for disadvantages. So much like the pill and the patch, it can cause nausea, moodiness, breast tenderness, and spotting between periods. But it can also cause vaginal irritation since you are putting it up your vagina, and it can also cause weight loss and weight gain. Who would this work for? A person who isn't good at remembering and is comfortable putting something inside their vagina. Next, we'll be discussing the hormonal IUD, which is 99% effective. So, how does it work? So, it is a small T-shaped device that is inserted into the uterus by a physician, and that's what it looks like in the picture. Just to let you know, there is also a non-hormonal method that we will be mentioning later. This one is the hormonal one. So the different types of IUD that there are is Mirena and Kylena, which can remain inside the uterus for 5 years. And there's Jadis, which is the current one that's pictured, and it can remain inside for 3 years. So the advantages of the IUD is that you can leave it in for 3 to 5 years, so it's not like you'd have to remember to take a pill or change a patch or replace your ring. It's just in there. You don't have to worry about it. And it can also lighten or stop your periods altogether. The disadvantages is that insertion can be uncomfortable, meaning that The procedure that the physician does is about a 15 to 20-second procedure, and obviously they have to open you up and put it in your uterus, and you have to be comfortable with that idea. Also, there is a possibility that you could expel the device out. It's not very common, but it can happen. And it can also cause some side effects, which include moodiness, and it is very known to cause acne. Who would this work for? So, a person who doesn't like routines, isn't good at remembering, is comfortable with a procedure, and also has heavier periods. Because, like I said in the advantages, it can stop your periods altogether sometimes. So, if you were to have heavier periods, you'd probably like the idea that maybe you wouldn't have any periods at all. So, lastly, we'll be discussing the Depo-Provera shot, which is 97% effective. So, how does it work? So, it is a shot that you receive every 12 weeks from a physician, and it only contains progestin in it. There's no estrogen. Unlike the other form methods that I mentioned, this one only has one hormone. The advantages is that it can lighten or stop your periods. You can use it if you can't use methods with estrogen in them. And it's also very convenient and private, as you are seeing a doctor or a nurse to receive the shot, unlike taking a pill every day, where you might have to do that in front of someone. The disadvantages is that you obviously have to get an injection. You need to access a clinic, which might be very difficult to do right now, especially with COVID. And it can also cause certain side effects, which include weight gain and weight loss, decreased bone strength. It can also delay your ability to get pregnant for up to 9 months after the last injection. And this is known to be one of the birth control methods that can detrimentally affect someone's mental health. So, if you're someone who tends to experience mood swings or maybe has been diagnosed with clinical depression, this may not be an option that you would want to pick, as it can really, really negatively impact your mental health. Who would this work for? So, a person who doesn't mind needles and doesn't experience the mood swings and severe depression that I mentioned. So, how can you access all these contraceptives that I mentioned? So, obviously, at our school, there is the Health and Wellness Center, and they're currently seeing people on a case by case basis, but it is mainly virtual right now. You can phone them at 416-287-7065 to book a virtual or phone appointment with a doctor for a prescription. You can also access them through pharmacies through prescription from your family doctor or various walk-in clinics. And also, sexual health clinics can provide prescriptions, and they do sell certain birth control methods at their clinics. This website, sexualhealthontario.ca, is also a great resource just in case you have any additional questions or need more support and or resources.
Thank you so much, Rachel. We'll now be moving on to some contraceptives that can be used during a sexual encounter. I'll be going over internal condoms, external condoms, and withdrawal, also known as the pull-out method. All of these forms of contraception do not require prescriptions and are non-hormonal. So first, I will be going over the internal condom. How it works is that the closed end will be inserted into the vagina with the condom covering the walls of the vagina, protecting it from incoming sperm. The outer ring at the open end of the condom remains visible on the outside of the vagina. The benefits are that it's usually made with polyurethane, which is stronger than latex, lessening the chances of it breaking. It also helps protect against STI transmissions, as it protects both the inside of the vagina and a bit of the external portion. The only big challenge is being able to insert and position it correctly, as all it takes is a misalignment of the condom to put the user at risk of pregnancy or STI transmission. The internal condom works best for penetrative sex and someone who prefers non-hormonal contraceptives. The sexual health team from a couple of years ago here at UTSC has made an in-depth video on how to use the internal condom, so feel free to use the link on the slide to check it out. Moving on to the external condom. How it works is that the user must pinch the tip and roll the condom down to the base of an erect penis. Pinching the tip is critical as it leaves room for ejaculation. The benefits are that since it serves as a barrier, it protects against numerous STIs. And as mentioned before, alike the internal condom, it is available at the Health and Wellness Center. Again, due to COVID-19 restrictions, we ask that students book an appointment to arrange pickup. Some challenges of the external condom include the risk of breakage, and if applicable, it's encouraged to couple this contraceptive with another one, such as the birth control pill, just to maximize efficiency and reduce risk. If you have a latex allergy, you need to be more cautious about the type of condoms you purchase. And lastly, there are other factors that affect the efficiency of the condom, such as the expiry date and/or the quality of the packaging. This works best for someone who prefers non-hormonal contraceptives. And the sexual health team from a couple of years ago here at UTSC had also made an in-depth video on how to use the external condom, so feel free to use the link on the slide and check it out. Lastly, I'd like to talk a bit about the withdrawal method, more commonly known as the pull-out method. It's where during vaginal intercourse, the penis is removed from the vagina before ejaculation. Some people choose this method when there are no other available contraceptives and/or they prefer skin-to-skin contact. There are challenges to using the withdrawal method, such as it doesn't protect against STIs, and the timing of the removal needs to be precise to avoid pregnancy. Some things to keep in mind are that with second intercourse, there may be enough sperm in post-ejaculate to cause pregnancy, and pre-ejaculate, more commonly known as pre-cum, may contain STIs including HIV and can also cause pregnancy. We recommend that you use other forms of contraception, for example, the internal or external condoms, if possible, because this is not the most reliable method of contraception for obvious reasons, but nonetheless, it is still a method used to avoid pregnancy.
Thank you, Bharti and Rachel. I will now be going over the contraceptives that may be used after a sexual encounter, which includes the emergency contraceptive pill as well as the copper IUD. So the emergency contraceptive pill. An example of the emergency contraceptive pill is Plan B, which is the most accessible at this moment. So the way that it works is that you ingest the medication immediately after, or as soon as possible after intercourse for up to 5 days after unprotected sex. It delays ovulation and the release of the eggs so that they don't come in contact with the sperm. So some benefits to this, it is highly effective, 95%, if it is taken within 24 hours. Some challenges of using Plan B is that it is expensive. It costs approximately $40 at a pharmacy, but at the Health and Wellness Center, it is $20, but you would need an appointment as well to come and pick it up. So the side effects seen are nausea and vomiting. They're not so common, but they are observed within some people who use it, as well as irregular periods for a short amount of time. There's also no protection against STIs. Who would this option work best for? It's for individuals whose first option of contraception failed and who also have used unprotected sex. So the copper intrauterine device, IUD, that Rachel had mentioned earlier, that is not hormonal. Some benefits, how this works is that it is inserted by a doctor within a week of the unprotected sex to prevent implantation. Some benefits to this, it is highly effective. It can stay in for 3 to 10 years. It can also be used as a before sexual encounter contraceptive. Some challenges is that there's no protection against STIs and it causes heavy periods. Who would this option work best for? Somebody who prefers a non-routine based contraceptive. For example, you don't want something that's taken every day, regardless of whether sexual intercourse occurs or not. Someone who prefers a non-hormonal contraceptive or has been recommended by a doctor that they shouldn't use hormonal options. This can also be used as an emergency contraception and left in as a regular contraceptive. I'll be going over some questions. So, what is an STI? So, an STI is a sexually transmitted infection that are infectious diseases that spread from one person to another through any type of sexual contact. You can visit the link provided on this slide for more information. What types of STIs have you heard of? Here are some of the answers from other students. As well, there's a link provided at the bottom that you can visit for more information. Some examples of STIs include pubic lice, which are tiny crab-like insects that nest in pubic hair, and early detection reduces and avoids health complications and minimizes the spread of STI to others. An example is HIV, human immunodeficiency virus, which attacks the body's immune system and it can develop into AIDS, chlamydia, gonorrhea, syphilis, herpes, and scabies, and there's a link provided as well for more information.
Not all methods of contraceptives protect against STIs. Condoms and dental dams are a good way to protect yourself and your partner from STIs. And for a refresher on what a dental dam is, these are a latex or polyurethane sheet that acts as a barrier between the mouth and the vagina or anus during oral sex, and they're primarily just for protection against STIs. When using these, use a water-based lubricant instead of an oil-based lubricant because this can cause breakage. And the challenges of using a dental dam is reduced protection if they're used incorrectly or if the product is damaged. You should always check that your hepatitis and HPV vaccinations are up to date. You can get a checkup for STIs from the Health and Wellness Center. If your doctor feels that they need to see you in person, this can be arranged on a case-by-case basis, and doctors will send blood work requisitions to students to take to a lab to do testing. We also need to remember that in the case of any sexual encounter, consent is key. Consent for any sexual activity must be freely given. Consent cannot be given by someone who is intoxicated, unconscious, or otherwise considered incapable of giving their consent. Consent can also not be freely given if it follows from threats to personal safety or threats to harm others. Being in a relationship or a marriage does not mean that there is automatic consent, and consent is not the absence of a no. Prior to engaging in any sexual activity, it should be clear that you and your partner are willing, comfortable, and in agreement to continue. Consent can be withdrawn at any time, and this can be indicated with either words or actions. No always means no, even if you or a partner initially agreed to a sexual activity or sexual activity has already begun. If any type of sexual activity, including sexual touching, kissing, fondling, oral sex, or intercourse, is forced on a person without their consent, it becomes a form of sexual assault and is considered a crime. We would like to share some links to the Sexual Violence and Support Center with you on our next slide. So these are some resources we would like to share with you, which include resources on STIs, information around contraceptives, our information for the UTSC Health and Wellness Center, and as previously mentioned, for the Sexual Violence Prevention and Support Center. And finally, we would like to thank you on behalf of the Sexual Health Team and the Health and Wellness Center for coming to our Wellness Talk. We wish you all the best and be well, UTSC.